Good morning, and welcome to our Friday morning education session. Please note that invitations to this practice short have been extended not only to the Specialized Geriatric Services team, but to other system partners, and we welcome everyone today. We are pleased to provide our COVID Series 2021 Winter Survival Kit via Zoom webinar. All attendees' microphones are muted and your videos are off. You will notice that there is a Q&A or a question and answer tab on the bottom center of your screen. Please feel free to type in any questions for today's presenter, and we will allow for some time for your questions to be answered. There is also a chat box in which you can relay messages back and forth. At this time, we ask that if you're attending today's session with more than one person on your device, if you could type into the chat box the number of people at your location. Today's session is being recorded and will be accessible on the Specialized Geriatric Services website under the Education tab under Monthly Education. For those of you who missed last month's practice short, you will find its recording in that location as well. We have come a long way since the COVID-19 pandemic was called in March 2020. And we know there is a ways to go yet, and it is uncertain how much further there is. But there is an end in sight. We can see the peak of that mountain, and there is hope. Maybe the journey was longer and harder than we thought it would be, but we're still moving forward. All of us, including those people we support, have had a different path through this journey with different obstacles in the way, but we have managed to get here. We are starting to feel the toll that it has taken, and we wanted to offer a Winter Survival Series. The intent with the Winter Survival Series is to create momentum, to continue to support older adults and healthcare providers, and to pull together to promote resiliency within the system. We chose the topic of the Winter Survival Series at the end of 2020, and we know that that COVID-19 is an evolving situation and things are changing from day to day. And we need to always make sure that we are checking reputable sources. It is our recommendation to have a look at the Simcoe Muskoka District Health Unit website, which is being updated frequently to reflect the current recommendations. The website's located at the bottom of the screen, and my colleague is typing in the website into the chat box for your referral. To begin our COVID-19 Winter Survival Series, we wanted to aim our focus on maintaining social engagement during lockdown. Today's presenter is Maureen Corbett, who comes to us with 25 years of clinical experience as a recreation therapist in 2 Ontario settings. Maureen has a degree in recreation and leisure studies, as well as a diploma in recreation leadership. She has worked as a professional practice leader for recreation therapy, mentoring both recreation staff and students. She is a former faculty member at Conestoga College and Georgian College. She launched a private company called Moda Consulting, a staff training and development company designed to support learning needs of professional staff. The focus was to provide customized, high-quality programs for organizations specializing in services for seniors. Maureen became the first memory living manager and supported the implementation of a specialized neighborhood designed for individuals who are in the early to moderate stages of Alzheimer's disease. Maureen has supported the Specialized Geriatric Services in developing the activity toolkit that launched in May 2020 and will be part of today's discussion. It gives me great pleasure to introduce today's speaker, Maureen Corbett.
Good morning, everybody. I'd like to start off by talking about older adults and social engagement challenges. The impact of social isolation and loneliness on health and well-being is recognized globally as a public health issue. As we age and become older adults, we find social engagement challenges naturally occur. There are 5 areas that impact by aging and engagement. They are physical, emotional, cognitive, social, and spiritual. To give you a little bit more information, the physical area. As we get older, changes to our physical body has a large impact on our overall well-being. Decreased mobility, decreased strength, decreased endurance, increased tension, and restless sleeps. When we look at emotional, as unknowns increase as we get older, there are strong possibilities for decreased feelings of autonomy, no sense of meaning, reduced self-determination, and decreased optimism. Under the area of cognitive, as we become older, we experience changes in our brain, and which leads to decreased ability to attend, decreased memory, decreased concentration, and the inability to follow direction. Social, the feeling of isolation, disconnection, and loneliness impacts meaningful relationships. In this area, we decrease communication skills, decrease interpersonal skills, decrease social confidence, and the inability to participate in social norms and make friends. And finally, spiritual. As we age, the ability to connect through religion and fellowship becomes even more challenging. Decreased feeling of balance and stability, lack of ability to be introspective, increased feeling of isolation and loneliness, and the inability to identify purpose, meaning and meaning in life, inability to feel calm. So going to the next slide, I want to talk about how COVID has impacted this. It can be challenging for people as they age to begin with, but now that we add COVID-19, it is even a bigger challenge. This pandemic is impacting us in many ways, the community as well as individuals. In the community perspective, frequent changes in regulations and restrictions impact delivery of programs and services across our sector, as we experienced yesterday. So once again, going through the individual impact, talking about physical contact, touch. There's no hugs anymore. When we are touched, it is to provide care and to perform a task. There's no comforting touch. Emotional, fear. We have fear in attending programs that are out in the community. Fear if having people come to visit us in our homes. Fear in receiving support or care because we want to maintain our independence. Cognitive. Everywhere I look, there are masks. I have the inability to recognize people, not remembering what is happening and why my family isn't around. Why can't I continue with my recreation activities? If it's going to a bridge club, if it's going to bowling, why? Social, mask impact on social connection. We don't see a person's face. We don't know if they're smiling. It also limits our eye contact with individual. Spirituality, the inability to attend church. Ministers are not allowed to visit into the community. And moving on, we'll talk about the strategies that address social engagement. All is not lost. There is always a way to work around these challenges. As a recreation therapist, I would like to walk you through what I would normally do to support seniors at risk of isolation. Within the recreation mandate, we always do a recreation therapy assessment. I start there. Within this assessment, we look at the client's physical information, take a look at a leisure interest survey. This is looking at their past and present activity level, leisure lifestyle information, and leisure barriers that they may be encountering. Within recreation service, there's 3 areas of treatment plan. They are therapeutic intervention, leisure education, and participation programs. To give you a little bit more information about this, I will start with the therapeutic intervention. This intervention supports cognitive skills, concentration, attention span, memory, orientation, problem solving, and communication skills. Then we move to leisure education. This is where the therapist would look at leisure awareness, leisure skills, knowledge, any adapted equipment that's out there, and community resourcing. Recreation participation is a sense of autonomy by choosing the level of participation that we would like to engage in. Motivation and activity level through a successful participation in a program. Social skills, positive attitudes leading to health and leisure and a healthy leisure lifestyle. Some of these things that I have mentioned are no longer in existence in our communities due to COVID-19. So moving to the next slide. In addition to what I just talked about, there are some real opportunities because COVID-19 is to be creative and to think outside the box. Community programs are pivoting on every change of the government restrictions. I have a couple of examples up here. In the late fall, let's say, there's an organization that has drop-in, and there's a meal that is provided with once a week, once every 2 weeks. They wanted to do a Christmas dinner, but how were they going to do it in the middle of COVID-19 pandemic? They gathered themselves together as volunteers, and everybody brought in food, and more volunteers came in who had access to a vehicle. The group that attended the dinners or the luncheons were provided with a hot lunch on the day of, as well as a link to a Zoom call. In the safety of their homes, they were able to enjoy a Christmas dinner and participate in a discussion over a Zoom call. This is one of the strategies that community agencies are putting in place. Another one is developing personalized fidget boards. I'm sure a lot of you are aware of what a fidget board is, but personalizing it and meeting the needs of that individual is an endeavor in its own. There are individuals in our community who would love to volunteer and help making these fidget boards. We have high school students that are looking for 40 hours of volunteer work. Another area is quilt making. Have an opportunity for our residents and our clients to take a man's handkerchief and either with fabric or washable marker or non-washable marker, Sharpies, to design what COVID-19 means to them, and then sending it to a quilting organization where they will build the quilt together. Thinking outside the box is what we really are required to do at this point in time. There's innovative virtual tools out there, as well as virtual travel, opportunities to go to China and visit all the museums in Europe, the Vatican. There are virtual tours out there for any individual of any interest. Private and public organizations have put resources online. The newest one that I just discovered is that Rogers Cable is now putting the Smart Exercise program on their television channel. Moving on, I'd like to talk about successes. Some of the things that I have encountered, moving my slide. Some of the things that I have encountered. I did an assessment with a gentleman, and we talked about the leisure survey earlier. He was an avid golfer in his prime. With COVID, he didn't get out as much as he used to, but family did get him out this summer. He thoroughly enjoyed it and loved the challenge of golfing again. So the family was able to purchase an indoor putting green. This putting green is set up in an area where he can manage to get to it on a daily basis. He's working on his standing balance, his endurance, as well as having a good time and having the opportunity to participate in a past leisure activity. We're all missing family. There is I don't know how new it is, but it's fairly new to my knowledge. It's a photo frame. We all remember the photo frames from the 2000s where you put a jump stick in the back and it would rotate some family pictures. Today, these photo frames can be accessed through emails. So any family member that has access to the password can update pictures. Maybe yesterday we had a celebration of a one-year-old's birthday. And today you can upload those pictures into your family, your parents' photo frame. The introduction Of tabs, this has become quite, what's the word I'm looking for, available. The tablets are not as scary as people have made them out to be. Putting few apps on it make it very user-friendly for our seniors and me to use and to access our family and friends through virtual calls. My challenge to you is to continue this momentum. Try and be creative, keep thinking outside the box, and brainstorm with your teams, and we can truly are doing this together. A resource that I would like to talk about is the resource that we talked about in the first slide, is the activity toolkit. It's a toolkit that we put together in May 2020. I think it is, I'm going to guess, it's about 50 some pages long. So it's packed with information. The information starts off with a breakdown of what leisure and recreation can do for our seniors. When we start on page 7, we can look at single activity tools. These activity tools are broken down into arts and crafts, horticulture, all kinds of activities that can be done. They're one-page activities that families can access, they can print off. The supplies are found in your home, if not at the grocery store, when you go out to do your weekly shopping. They're broken down into simple steps, and it's an activity that people will find they're successful in and that they enjoy. Moving on to page 42 of the book, or 44. I'm not sure, sorry, I've lost my count, but this is where virtual resources are placed within this toolbox. The family members can bring up and read out what the resources online are. And a control click will get somebody to the Vatican, a museum, the pandas, to be able to watch the pandas. This is a resource that can be used over and over again. And I have sent it out to many of the people that I am now doing treatment and therapeutic intervention with. Does anybody have any questions?
Just checking the Q&A box. Maureen, it's Allison
Okay.
here. Maureen, we have a question. How long
Okay.
is your wait list?
Actually, if we had talked first week of January, it was a little longer, but I have been successfully able to discharge some people. So I am looking for new referrals if anybody has anybody out there that you think could benefit from this service.
Maureen, can you tell us how to refer to you?
You can either refer to me through email, or we can, that's about the best way that you can refer to me, or go through Meditech.
Great. Another question we have here is, how are you suggesting people without internet resources get services?
That's a good question. There, through services, I just need a little clarity. Through services, through the toolkit. As I said earlier in my presentation,
Yes.
Other organizations, private organizations, are now stepping up. As I said, Rogers Cable is now putting the SMART program on their cable network. So there's exercise opportunities on someone's actual TV. Other than that, it's through phone calls and linking me up with family members and making sure they have access to the right treatment.
Great. And there is a question around those without access to Meditech. They just simply need to email you. That's correct, Maureen?
That's correct.
Okay. We have a question here around the SMART exercise program on Rogers. What are you aware of what equipment is necessary, or is it just the television?
It's just the television and the cable network. It's the channel that Rogers does their entertainment and their information sharing on. Me being in Cambridge and you being in the region that you're in, I'm not sure of the channel.
Wonderful. So there's some interest in obtaining the toolkit again, and we'll make sure that's available in the chat box, a link to the activity toolkit.
Perfect.
Question here, is your service considered essential? If so, could you send someone into the home at this time to provide one-on-one contact?
Not at this time.
Not at this time, okay. Can we refer caregivers to you to assist them with identifying self-care opportunities?
Yes, that is an opportunity. It would fall under the leisure education component of my treatment.
Excellent. We have a comment, not a question, just to say thank you to you for creating this activity toolkit. Blair McMillan has said it's an excellent resource that she has shared many times with clients, family, caregivers, and other healthcare professionals. So kudos.
Well, thank you.
Just checking here. We've got the toolkit up on the chat box now.
Okay.
Maureen, I think that's it for questions at this time.
I appreciate the opportunity to speak to everybody today, and please feel free to reach out to me. Allison, will we be putting my email address
We
on
will.
the chat? Okay.
Yes, we'll make sure that's in there. So,
okay.
Maureen, on behalf of all of us on the call, I would like to take this opportunity to thank you for your information on maintaining social engagement in ourselves and in the people we support. I feel confident that the information you've provided will go a long way to help us to start to fill our COVID survival kits. I didn't tell you ahead of time, Maureen, but there are 88 people on the call, so I feel that your topic resonated in most definitely with the group here. I'd also oh, go ahead, Maureen.
No, you go ahead. I'll let you finish.
I'd also like to thank the participants for being so, for coming, and for also your questions for Maureen.
Yes, I'd like to reiterate that. I really appreciate everybody coming out, especially on a Friday morning. I don't know what it's doing up there, but it's another gloomy day here in Cambridge. So please enjoy the outdoors as much as you can over the weekend. Thank you so much.
I have one request for you. Would you mind just sharing your email address? Kim is going to be typing it into the chat box.
So it's mcorbett@northsimcoe-muskoka-sgs.ca.
Wonderful. Thank you very much.
Okay.
I wanted to remind all who have attended today that there will be a recording of today's session, and it will be found on the SGS website for future reference within the week. I also wanted to draw your attention to the next practice short in our COVID series 2021 Winter Survival Kit, which is entitled Self-Compassion and Resiliency, which will be taking place on February 12th at 8:30. I've placed up here a flyer for our seniors mental health program. We are running courses in the next quarter, and the next one coming up is our seniors mental health course, which will be running February 1st and 2nd for unregulated, and a third day is added for regulated staff as well. It's a 2-day evidence-based interactive curriculum, and it's open to staff who support seniors in our systems. It is currently being offered complimentary, and the reason for which we're highlighting it today is the deadline for signing up is Tuesday, January 19th. So please head to the nsmsgs.ca website for an opportunity to sign up for a complimentary seniors mental health curriculum. At this time, I would like to thank you again for attending, and please feel free to reach out to any of the psychogeriatric resource consultants if you have any questions. And I would like to wish you all a happy and very safe weekend. Thank you.